Hello and welcome. Today we're here with Dr. Amy McMichael, who chaired LiVDerm Deep Dive into Racial Disparities. Dr. McMichael, can you give us a brief overview of the LiVDerm Deep Dive into Racial Disparities program and why it is important for dermatologists to know about this?
Oh, absolutely, Amy. Thank you so much for having me and for asking me about this. Well, I'll tell you one thing. The racial disparities piece in dermatology and really in medicine in general is one of my loves, and it's been one of my passions ever since I started in dermatology. So really, it's truly a labor of love to work in that area with the amazing specialty physicians that we had joining us. We had Dr. Taylor, Dr. Desai, Dr. Pearl Grimes, Dr. Andrew Alexis. I mean, the entire team was just phenomenal. We had a pediatric piece with Dr. Heath. So the important reasons for doing this is number one, not enough light is shone on racial disparities in dermatology. We're starting to get to the point where we're recognizing that this year, 2021, and I've been in dermatology for 27 years. So it's a little late, but we'll take it. And the reason that that's important is because a great deal of our population in this country is considered a minority population, and certainly patients with skin of color are going to be the majority here in the U.S. By 2045, 2050, however you look at the census. So we're just starting to get to the point now where we can actually help these patients by getting the word out to other dermatologists about how these conditions look, how hyperpigmentation is such a big part of these conditions, how these conditions affect the patients that are having them, and really, just really how to approach treatment in these patients.
Now, Dr. McMichael, can you highlight some of the systemic issues that specifically contribute to a lack of knowledge about identifying and treating dermatologic conditions in patients with skin of color?
Oh, absolutely. There are many conditions that do not have a great deal of inflammation or redness in patients with skin of color. And so if you mistakenly think that, okay, this patient doesn't have psoriasis, or this patient doesn't have lupus, or this patient doesn't have very severe atopic dermatitis, they're just scratching their skin, then you actually undertreat and mistreat the patient. And that means that they're left with pruritus that they can't control. They are left with marks that they don't understand. And in the case of psoriasis, indeed, they may have undiagnosed psoriatic arthritis because you never diagnosed their psoriasis. So why would you ask them about their arthritis at that point? So these are, just some of the very many things that we could, talk about today that, really affect these patients deeply.
Have you seen a change in the representation of patients with skin of color in clinical trials?
Well, clinical trials are interesting. I have a skewed view of clinical trials because, I am a person of color and I have a large proportion of patients who are coming to me because of that. So I think that my group of patients, is very mixed. I see patients of all ethnicities, of all races. And so for me, it's not really increased. Maybe in the more recent years, patients with skin color are asking for trials for their skin diseases. A lot of times there aren't many hair loss trials. For instance, in scarring alopecias, there aren't a lot of pigmentation trials, that sort of thing. So I think patients are requesting the trials for the things that they have. However, I think that the classic individuals who run trials often don't have patient populations that support a lot of patients of color being part of the trial. So I think we still have work to do in that arena.
Where do you feel dermatologists can continue to improve in terms of recognizing disparities and treating patients with skin of color?
Well, I think we all have room for improvement. So I think that any dermatologist who doesn't feel comfortable seeing patients with skin of color should definitely spend their time coming to programs like the LiVDerm deep dive. I mean, I think that we're putting on these programs for really the group that's interested in this and interested in learning more. I think they can seek out programs that we're putting up, for instance, the American Academy of Dermatology, really for residents, but it's going to be for all members of fellow members of the American Academy of Dermatology, where we're going to have cases that have skin of color photos. I mean, this is something that you have to avail yourself of. These are going to be options for providers to learn about skin of color. So I think that everybody should make sure that they feel comfortable looking at skin of color, that they feel comfortable that they're not missing things in skin of color. Don't be afraid to biopsy things earlier. And then they need to go and read about and expose themselves to these issues in, the forums that, we're talking about today.
Great. Now, Dr. McMichael, is there anything else you'd like to add before we conclude the interview?
Well, I'm just really excited that, I've had this opportunity to work with you guys. I mean, I think the LiVDerm deep dive was so very fun, and as someone who immerses myself in this field, I still learn something every time I hear, my fellow colleagues talking about, the topic of melasma or the topic of pediatric skin of color diseases and how they can be approached better. I think that we all have a lot of things that we can learn from each other, and I think that no matter how comfortable you feel treating patients with skin of color, is always more to learn and more to do. And so I hope that we can continue to put awesome programs like this out there and get awesome speakers and get our colleagues to really take part and enjoy them.
That's all the time we have left for the session, but thank you so much for joining us.
My pleasure. Thank you.